Hi, myself Dr. Pooja Bansal, consultant gynecologist at Navi Mumbai. So today we are going to discuss about the very commonly found finding in the ultrasound, that single loop of cord around neck. Now, women, as they see this finding, they get panic and ask multiple questions like, did I do something wrong? Did I do some exercise which can be the cause of such kind of cord around the neck? Or my position of sleeping was wrong? Or did I eat something wrong? Will this cause any harm to my child? And will I be able to have a vaginal birth? So looking at all this questions, we first understand what is umbilical cord. Umbilical cord is a cord which is attaching baby to the placenta, and this supplies the nutrition, blood, oxygen and other nutrients to the baby. Now, what happens why the cord gets around the baby neck is because either the baby is having many movements which can cause the cord to get entangled around the baby. The second, either the cord is too long. That also is one of the reasons. We have too much fluid or too much space basically to swim in. So that could be one of the reasons to cause such kind of cord. It's a very, very common finding. Almost 20 to 30% of pregnancies do have cord around the neck in their third trimester. Now, what needs to be monitored when we have cord around the neck is the fetal movements. The first thing that I tell my all patients is to keep observing the fetal movements. Generally, if the movements are fine, it's not going to cause any kind of a harm. If cord get tied by chance, the most of the time babies do cause certain movement in that cell and relax the cord. By doing the ultrasound, the circulation in the ultrasound, when we put a Doppler in the ultrasound, that gives a very good idea that the loop is not very tight and it's getting a good supply, so the baby won't be harmed. The most commonest finding seen while you're in labor is that if there's a cord around neck and it is a short cord, will not let the head descend down. So when you're in labor, the baby will not descend down. You may be in labor for a longest period of time, the dilatation had happened, but the baby will not come down because of the short cord. That may be the indication to take the patient for a C-section. The other, if the tight loop is there during labor, while contraction, it can give rise to the deceleration in the baby heart. That means the fetal distress. That also can be tackled by taking the patient immediately for the C-section. Most of the time when we see the vaginal birthing, vaginal deliveries, lot of patients who had no ultrasound finding of cord around necks have cord around necks while we are delivering. So it is not an indicator for a C-section. Vaginal birthing can be done with a cord around the neck, but definitely when the baby delivers, we try to remove the cord immediately and deliver rest of the part. So it's a very common finding. We should not be scared of it. Just a monitoring movement can give rise to a lot of information and serial ultrasounds. Unfortunately, you cannot do anything to reverse the cord around neck. So neither your movements, exercise, diet or any kind of interference or any routine lifestyle will change the cord around neck. Thank you so much.